A deadly virus, first wave, second wave, post-COVID complications, people in India have been fighting all of this for a year and a half. But there is one more struggle to get vaccinated. Good evening, you're watching Fact of the Matter with Navya Singh. After vaccination against coronavirus started, there was a sign of hope in the fight against a pandemic that had devastated livelihoods, economy, and brought everything to a standstill. Vaccination for those aged between 18 to 45 years of age started on 1st of May. Now, this age group is not just getting infected with the virus, but it's also suffering from severe effects of the infection, including prolonged hospitalization and, in many unfortunate cases, even death. Individuals in this age group have to pay to get vaccinated, but the condition for those above 45 years of age is different. They got their vaccines for free at government-run vaccination centers and will continue to get them for free. Now, although the COVID-19 vaccination in government hospitals and centers is free of cost for people, the government has allowed private hospitals to charge for vaccinations. And the cost can range anything between 250 rupees to 1800 rupees depending on where you get it from and which vaccine you choose. This is definitely not affordable for everybody, especially at a time when the impact of the economic slowdown has left crores of people without jobs or a means of livelihood. Some centers have been charging as high as 1800 rupees for one shot of Covishield, and this is in the national capital. Out of more than 300 private centers offering Covishield, 84% had fixed the price at 800 to 1000 rupees per shot. But in reality, at least 25 of them charged more than 1000 rupees. Out of 149 private centers administering Covaxin, 90% charged between 1200 and 1400 rupees. In the case of Covishield, it was estimated that people in the poorest urban households will have to spend about 75% of their monthly expenditure to get vaccinated at private hospitals. The cost of Covishield at private centers makes up for about 22% of an average urban household's monthly expenditure. Now let's understand this with the help of images and data. The median price of Covishield is 850 rupees. That of Covaxin is 1250 rupees. An urban household spends about 4000 rupees, or say 3858 to be precise. This urban household spends about 156 rupees on its medical needs. The same household that is now being forced to pay about 850 rupees for a Covishield vaccine. This household will eventually have to spend about 22% of its entire monthly expenditure to get vaccinated. And remember, vaccination is the only way out of this pandemic. The middle class or the urban household do not really have a choice. Let's take a look at another table. The poorest 5%, and here we're talking about the poor, middle class and rich in urban areas. The poorest 5% in urban areas, their monthly expenditure is about 1100 rupees. They have to spend about 75% of this 1100 rupees on vaccination. Same as for the middle class, they'll have to spend about 29%. For some people, 1000 or 1200 rupees is their daily budget, and for others, it's their monthly budget. People who are struggling to satisfy their basic needs will have to spend all that they have to get vaccinated. It's even worse for those who are the only earning member in their family. Now, let's go back in time a little. On 1st of May 2021, Finance Minister Nirmala Sitharaman had said that the government has provided 35,000 crore rupees for vaccination in the annual budget 2021-22. She said the government is committed to provide more funds if needed. Now, if those in the age group of 18 to 45 years have to pay to get vaccinated, what exactly is this 35,000 crore rupees budget being used for? Let's try and understand this in detail. When COVID first started spreading in 2020, hand sanitizers disappeared from the market and they were being sold in black. This was because the demand was more than the supply. After seeing the high price of sanitizers, more entrepreneurs decided to enter the business and the problem was solved because prices were reasonable. But can this happen in the case of vaccines? No. Free or affordable vaccination for everybody makes sense, not just for humanitarian reasons, but also for economical and equitable reasons. Vaccination helps the society move towards herd immunity, a situation where enough people have the immunity and can stop any further outbreak of the virus to accelerate. This helps the economy. The sooner we achieve this, the faster any economy can recover and restart, and the government will no longer be forced to impose any kind of restrictions or lockdowns or curfews. But again, this comes at the cost that only the government can bear. If the government spends the 35,000 crore rupees that it said was allocated towards vaccines, it will benefit the overall economy tremendously. This 35,000 crore rupees budget is definitely less than the cost of a prolonged crisis devastating economy and lives. The Supreme Court on 3rd of June raised concerns over centre's policy of giving free vaccination to the 45 plus age group in the first two phases of vaccination and having a paid system for those below 45 years of age. The top court called it arbitrary and irrational. The court also questioned and asked the centre to explain how the 35,000 crore budget is being utilized and said if the states are being forced to provide free vaccines by spending their own money, then it would affect the states' development schemes and their efforts to improve or ramp up the health infrastructure. Now, the similar demands have also been raised by researchers at the Indian Council of Medical Research, and remember, this is the country's top medical research body. It said that vaccination should be made free to increase its use and reduce the death toll from infection. Many states have demanded that the government should provide free vaccination for everybody. As more and more states joined the chorus for free universal vaccination, the demand gained political momentum on 3rd of June, with the Kerala Assembly unanimously passing a resolution that the centre should make vaccines available free of cost to all the states in a time-bound manner. The resolution moved by the Kerala Health Minister, Veena George, said that the most suitable preventive step against any deadly pandemic was universal vaccination, but asking states to procure vaccines from the open market is highly objectionable. The goal of a vaccination policy during a global pandemic should be to achieve maximum coverage, as close to universalization as possible, and do so quickly and cost effectively. The policy has to be equitable so that it benefits the poor and low-income families who are the most affected during the crisis. In most of the major countries, vaccines are being given free of cost. Countries like the US are vaccinating billionaires for free. Not just that, undocumented workers are also part of the free vaccine program. But the situation in India is not the same. The easiest way to ensure maximum coverage is to offer free vaccines to everyone. But India chose to create a private market for vaccines amid limited supply. This affects those Indians who are the biggest victims of this health crisis. An interesting survey conducted by Gaon Connection, now this is a rural media platform, has said that the major concern for a large section of the rural population in India was affordability. At least 36% of the respondents of the survey expressed their unwillingness to pay for vaccines. Since the question of affordability is one of the primary reasons for vaccine hesitancy, it needs to be addressed with urgency. The vaccination process cannot leave out a certain or rather a major section of the population. Online registration systems, reliance on digital apps, portals, OTPs, this entire process makes it very difficult for those who don't have access to phones. We must make it extremely simple and easy for people to get a vaccine. All citizens, irrespective of their financial or social status, must be beneficiaries of these services. India's poor track record of health infrastructure and spending is well documented. The country has spent little above 1% of the GDP for the past decade on healthcare. The National Health Policy of 2015 estimates that more than 63 million people are faced with poverty every year due to healthcare costs. This explains why free vaccination for all the citizens would be the least that the government must do to fight the pandemic.